A previous guest that was Ned Parks, if you want to look back to that episode, he said nonprofit is a tax status, not a goal. And I absolutely love that because as a nonprofit, you realize you still need to market. There's challenges. You need to communicate your mission to people. Oftentimes, as a nonprofit, though, there's other things that kind of go in the way or make it more difficult. So you have to be more creative in how you reach out to people. That is exactly why I have Jessica Yeager on today. She is the Communications Operations Manager, I had to read that, for Ohio Guidestone. If you want to learn how to get some creative solutions for your marketing, stay tuned. Thank you for coming on. I really appreciate it. So, Ohio Guidestone. You guys work with all sorts of like mental health, other items, correct?
Correct.
You've got to comply with like Google Meta restrictions because there's a bunch of people out there trying to a lot of outside promises and stuff like that. So you guys need to make sure that you stay kind of within these guardrails because there's people out there that abuse that type of stuff. When it comes to stuff like that, what are some of the challenges that makes where you can't be like this free for all? You've got to stay focused and like this needs to fit in this. I mean, it's not necessarily round peg, square hole, but how does that kind of fit in there?
I think there are two very good examples I can give to you. One of those being from the Google side and advertising addiction services. You have to have a certification in order to do that, to advertise any type of actual medical service. So we had to actually get a legit script certification. They're a third party from Google, and they act as this source to verify the legitimacy of a healthcare provider. So that was quite a hurdle for us to even go through and get that because we had to license all of our locations. So we have over 30 locations across the state. So each location had to be certified. So that's something that we've done and was a huge piece for me to be able to get that done for our agency as well. So that is just one thing that lets us get over the hurdle to say, yes, we can advertise on Google and have those addiction services advertised. But it's also a necessary evil as well, right? Because you can't just have anybody, offering healthcare services or
we don't want this.
Pharmaceutical things.
It should not be the Wild West,
right? So it's a necessary thing to have, but definitely a difficult thing for those of us working in the healthcare space.
Wow. Yeah. So there's that challenge with that. Another challenge is, and you mentioned you guys do a lot of staged photo shoots because you work with mental health, substance abuse, things of that nature. It's not something where you can be like, hey, do you care if we take your picture on the way out? That's not something where people typically want that. When you've got to do stuff like that, what are you looking for when you're looking to say, look, we need to have a successful photo shoot here? What are you trying to convey? How do you make sure your message is coming out in that, I guess?
It's really the environment and the emotion of the people, that warmth, the comfort. I always say our services are not provided by somebody in a white coat. They're not coming out in this white coat. And if you look up stock photos for health services or behavioral health care, that's what you will find and see. So you really have to be creative and work around those things. Our clinicians work with people in the field, and so they go and meet people where they are. So we meet kids in the school. We go out to people's homes. So that's what we want to be able to represent, is the breadth of our services and how they are provided. So honestly, sometimes we will use our own selves and our staff, and sometimes just appear as the client.
Sure.
And it's a good way to get around things, but also still be in the environment if we are in the office or providing a service or what have you. So that's something that we do. And we also just look for other ways that might be representative of a service. Maybe it's just two people talking in a library, something like that, where they can be more reflective. It's more about the energy behind it and the passion and care and concern of making someone feel comfortable. So when they see an image, we want them to see comfort and make them not that like sterile environment that like you might see as a hospital or something like that.
Okay. And it's funny you mentioned the stock photos because, yeah, if you search something like that, you're going to get that sterile environment. It's stuffy. It's not welcoming. And you guys are trying to, definitely play play in the opposite direction of that stigma that, hey, look, this is welcoming, this is warm. We're here to talk to you. So you guys have to be very, very intentional about that. And that's a tough thing to pull off.
It can be. I think we communicate with our offices as well. So we never want to just walk into an office one day and say, we're here to take pictures. We can't. That would be not a great thing for our clients who are there.
A little awkward.
Yeah. So, and if we do have a client that is willing to share their story or be photographed, we always work very closely with our clinicians and providers ahead of time to make sure that those things are taken care of and that they're comfortable and working in that way. So we're never just barging in someone's, counseling session saying, yes, exactly.
With that, you've mentioned that, I mean, before we hit record, a lot of employees are really passionate about what you guys do. And that to me is amazing. I mean, that makes it, I don't want to say easier to market, but that makes it so much easier to come to work when people love what they do. How do you get those employees to tell their stories? Because in so many cases, I mean, I've talked about it. Just because someone's passionate about what they do doesn't mean they can convey that message well. Do you guys work with people on how to convey the message and how to push that message out?
We do. I mean, we have our agency branding, and so we're always pushing those just general points like our mission, talking points, all of those things. The other piece that we do is we really have a lot of communication with our regional areas as well. So we know what's going on, and they feel that we have a two-way street of feedback and conversation. So if they have a client that is doing really well or is really proud and they think would want to share their story, that's really the relationship building that's going on behind the scenes within our organization so that we're able to share those amazing success stories. The clinician or whoever's working with the client can make them comfortable as well. And then it's very nice, warm handoff
to you guys,
to our team.
I love that. I want to talk language. Language is something that many people, I feel, miss in their marketing. And you've been very, I mean, in some of the questions I sent you ahead of time, you talked about non-stigmatizing language. That has to be, I'm assuming, very intentional in how you word those things. How do you make sure that the right language is being used in so many of these things? Is is there a list of no words? Is there a list of yes words? What brings that intention along, and how do you make sure that's executed, I guess?
The non-stigmatizing language is something we've really worked on with our team over the past 2+ years. Just with the shift and making sure. I think a really great example of non-stigmatizing language would be to say a diabetic. You actually should not say this person is a diabetic. It's a person with a diabetes, condition or disorder. So the same thing goes for suicide. A person died by suicide. So it's removing this person being inflicted, and it's just a symptom of the person.
That's interesting.
Yes. But it's very hard to get started and wrap your head around it, and because it's not how we've traditionally spoken.
Sure.
But it's very important to be able to make that shift, and that way we're being very careful and mindful of who we are speaking to as well. So you're not going to call somebody an addict. It's a person with an addiction, and that just sounds a lot nicer if you really sit down and think about it. So
it does. And it's interesting from a couple of perspectives on that, because first off is it makes it so it is, like you said, it's a symptom. It's not the overall thing. It's not them as a whole. It's not defining that
That's
person.
That's exactly right.
It's a symptom of a condition, which to me, the two things that I see in that are kind of brilliant is, one is it makes it easier for someone to say, look, I need help for this. And two, it makes it so it is not the person. It is what's going on with them in that current time. Yeah, I love that. So it's that intentional language helps in both the marketing and in the care then.
Yes.
Oh, I love that. You've talked about how storytelling is huge. There's all sorts of wonderful stories because you said you guys work with addiction, mental health, things of that nature. How do you pick some of the stories that get told?
We definitely try to make sure that we're touching all of the regions that we provide services in as well.
Sure.
So we're not just focusing on like our Northwest area for one, that we're really making the rounds and sharing all the different areas, because some areas are more rural, some areas are more urban. So naturally, just the culture and environment can be very different for those people as well, and what their daily life and experience is. So we're always meeting with our regional vice presidents, talking about what's going on there, and then really thinking about every service that we provide. We do a lot at Ohio Guidestone. I know you helped us with a video for a client that we did a success story on, and they were a substance use client. But we also have workforce clients. And so we're helping people with job readiness. We have mental health. You know, we run a gamut of services. And so the point of the success story is to help someone else. And it's like that extending hand, right?
Sure.
So they're sharing their story so that someone else can relate to that and understand and ask and receive help. So one that we're working on now is really for a parent mentoring client. So they can talk about their experience and what it was like to be able to be reunified with their child. So all kinds of different perspectives. And I think just we understand our services as well. And so I think having the integration of our communications team and understanding what we do at Ohio Guidestone is also very helpful as well for us.
That brings up an interesting question for me, because in so many cases, like, I mean, for us as a company, we're marketing to businesses to bring in to help them do marketing. It's a niche. I know who I'm aimed at. You're very broad in what you guys cover. I'm a big one that says, okay, if you're marketing to everyone, you're marketing to no one. You're marketing to a wide, very wide group of people. I mean, anyone from teenagers up to, I mean, adults, up to even late adults, I'm assuming. How do you get that message to all those people? Is your podcast not getting the results you hoped for? Are you feeling stuck and unsure how to grow your audience or make a real impact? We get it. Podcasting can be a challenge, but with the right strategies, it can be an incredibly powerful tool. That's why we're offering our free no-pitch podcast consultation. We'll spend 30 minutes with you identifying areas for improvement on anything from optimizing your audio or video quality to developing a content strategy that resonates with your customers. If you're ready to unleash your podcast's full potential, visit the link in our show notes to schedule your free consultation. Space is limited, so sign up today so we can help you create a podcast that truly shines.
I have this conversation when we go through for our Google ads and going back to that, and you know, you're picking your target audience and you're selecting the demographics, and you have to choose someone. You know, we were talking about this earlier as well. You do have to choose someone, but it is hard when we're talking about who we are as a whole, because we provide services to everyone. Yeah. And so from age 6 to the end of life, we're there to help meet your needs. But then who's reaching out to receive the services? It's probably not the 6-year-old, you know, so
don't need to market on Barney.
Yeah. And I think that's where we can run into some other issues as well with job readiness, and you're showing those types of advertisements, you can run into trouble. You can't put age ranges. So if we're showing a job readiness program for 18 to 22, we can't target that age group because it's, there's the classifications on that because it's job related.
Right.
So I think the benefit for that if it reaches other people that are outside of that, they're still learning who we are, and maybe there's another service. I think we're very fortunate on that side that, yes, we offer so many services. So maybe there's something else that's relatable there for them. But trying to narrow it down and pick one person when we have so many things, it is a huge challenge. Our CCBHC Certified Community Behavioral Health Clinic is one where we're marketing and trying to reach many different people. And we've just had to sit down and say, like, these are our 3 audiences. This is who we're talking to. This is who we're trying to reach. And what those main things are. Again, I think if you're trying to cast the wide net, you might not find anybody. So, like, make the message very tailored to those specific people. And I think that is, again, through storytelling as well and telling the story to that very specific person.
So you've still in that group, you've decided to pick like 3 main audiences. So that way there is, and it is 3 specific people. So it's not, you don't need to pick one person necessarily. You can pick 3 people. And I'm assuming, are those 3 different programs then?
It's one program.
No kidding. But it reaches such a wide swath. So you're using you're hitting 3 different segments for one program by doing, is it 3 separate campaigns then?
There'll be different campaigns, sometimes different messaging. So again, if we're trying to reach the decision maker in the household, sometimes we have to think outside the box there, like who is reaching out for a referral? What does that person look like? We always have to look at zip codes and how far are people traveling to receive services, or how far are we reaching people. But we also provide telehealth services. So technically our reach is within the entire state of Ohio. So it's really a learning process for us as well. And I think as the way people receive services change, we're learning and trying to adapt to those different populations and demographics too.
Has there ever been a campaign where you're like, okay, these are the people that we're talking to, and then you look at the analytics later and you're like, we're talking to someone else, but it's working? Has that ever happened, or has it typically been pretty successful in targeting the one group?
I think even if we don't reach the intended audience, we're still reaching someone and the result is positive. So I think that it's been overall successful. One of our areas is the households that we're trying to reach. Many of our clients are Medicaid recipients or Medicare recipients. And so sometimes we'll hit more of these private insurance clients, which we're able to take, but that's not really our intent of who we are trying to reach. So that's also, the struggle of the income limitations and things like that. So I think that's one where, again, in our Northwest area, we've done a lot of different marketing and reached a lot of different people, and we've seen an influx of people needing services there, which is great. I mean, that's ultimately, we want to help people.
Yeah.
But then sometimes it can have the consequence of, not reaching the exact right person. So it is very important to know who, what, when, and where your audience is.
How do you figure out that audience? Is it looking at who's walking through the front door typically?
I think so. We can work with our intake team as well to see where people are hearing about us. We also, on the back end, are trying to use things like through our website to see where are people coming from. I think that's the benefit of social media, is seeing where the clicks came from. So being able to use those digital tools is very helpful.
You've mentioned and I got to read this, ADAMH boards. You collaborate with them. What is an ADAMH board first off?
They're mental health and addiction services boards. So every county has one.
Awesome.
They provide grant funding to agencies just like us to be able to provide the services to the community.
How does the collaboration work with them? Is this a marketing thing, or is it mainly through the grants, or what do those collaborations typically look like?
From my experience, it's a communications piece, but then we also are linking in the community as well to provide services and programs. Essentially, all of the providers under the Adams boards are trying to meet the same needs. We're trying to improve the outcomes in the community and be available for individuals. So from the communication side, I think it's really wonderful. As I mentioned to you, both in Summit County and Franklin County, we have a great communication provider network. And so all of the organizations with the marketing and communications teams come together and we meet collectively, which is kind of unusual if you think about it, but it's really helpful to see what other people are doing, what's going on. And then we're accomplishing, we all have the same goal, right? So it's really nice to be able to do that and know what's going on in the different communities. With
that, you guys aren't necessarily in competition with each other. You are to an extent, but there's a collaborative nature too of we're here to help people.
Yeah, and there's definitely competitors that are within those pieces, but I think, we can support each other and still be a competitor. And I think that's really the great thing and shift in looking at it that way, is really hearing other people's voices too. I mean, we really can help each other.
I love that. There is a misconception that someone needs to be in crisis to seek mental health services. To me, from a marketing standpoint, when I heard that, I started thinking about this as like, okay, is this a marketing thing? Is this a PR thing? Is this how do you manage that image to reach people to say, look, we're here to help you before it's an emergency? How do you make it so the message is strong enough that it reaches people, I guess I would say, before it's an emergency?
It's definitely part of the stigma fighting piece for mental health as well. Don't be afraid to ask for help. We're here. A lot of what we use in our messaging is we're ready whenever you are. And so whenever that person may be ready, we're available and ready to meet you. And we mean that from literally wherever you're able to meet too. You don't have to walk into our office. We can come to you. You can call us. We have crisis lines as well. So I think that that's really important is people's comfort level too. Because it is a hard thing for people to reach out and ask for help for just about anything in life, sure. Not just, mental health services or substance use services. So like providing educational pieces and data points
sure.
and things like that. And that's really able to help people relate and understand and that they're not the only one. They are not alone. There are other people experiencing this. And it's kind of a whole circle of everything else we've talked about as well with the storytelling and making it relatable. And we can help people if they're in a crisis too, but
sure.
we sure. really would like people to get the help before they're in a crisis situation so that they can really lead a healthy life with great outcomes.
So it really, through the marketing, it's kind of like lowering that threshold for when someone says, I need to make a phone call, rather than saying, okay, this is an emergency. I guess I would say it's almost like anything else medical. Go before it's an emergency.
and people wait there too, right? I mean, people,
yes.
You're waiting until you have a heart attack to receive any, health care or anything like
right.
that. So
right.
I think in everything we do, it's reaching out to people and letting them know and just continuing to help provide information and help fight the stigma as much work as we can do and just be creative with how we do it.
It's that creativity because there's so many things that in marketing are loud. Everyone thinks of the used car salesman where they're screaming into the microphone, Sunday, Sunday, Sunday. You can't really be loud, I don't think, about mental health. What are some of the things that you use to make sure that you're getting in front of people, but not in a way that's in their face or intimidating or whatever?
Again, the success stories are great.
Sure.
People being able to share their own lived experience is huge. I think we do things from a multitude of different ways. So the educational data that we're sharing, the other pieces of things we do are really working from an advocacy level and working with the state and federal level to make sure that policymakers and lawmakers know the importance of the services in mental health. So working there as well. We have an institute that does different things, and one of their main focuses currently is working with fathers. And there's another stigma of fathers' feelings. And, we often talk about mothers with depression or maternal depression, but dads can experience those things as well. So
sure.
There's a different focus there in education. And so they work a lot with people in the community and they do like dad's days. And so we're also trying to meet people as well and just be available and just continue to show up for people and be there and be a support.
You've expressed some optimism about the future of digital communication and mental health advocacy. There's a lot of stuff out there on some of the social media platforms of it, varying degrees of accuracy and or help. We've all seen it. Social media gets blamed for a lot of the mental health issues. How do you see it helping and supporting mental health awareness moving forward?
I think everyone has an opinion, and
sure.
many of us are not afraid to share it. So I think we have to take advantage of that, truly. we're able to have conversations with people and have that dialect and talk about what is going on in the climate of the world. So let's say something happens out there that affects, people's mental health, and people want to respond in a certain way or they feel a certain way. We can actually communicate with those individuals and share information if something is incorrect as well, and give them real factual data. So I think just continuing to be optimistic about all of the opportunities there is a really good thing. We're able to share more digestible things for people that then they're able to share. So we can get people behind our advocacy too, which I think is just really big. I see a lot more on social media of like, it's okay to ask for help and everything's not always okay. And just accepting that life is not always perfect too, I think is also part of that. So it all works together. I think it's just nice to see. So having conversations, using it as a positive tool, and, stepping away from the negativity where we can, or addressing it is I think a good thing.
I've heard you mention education multiple times through this. Do you think that is a big piece that's missing from what a lot of people are receiving in their mental health, I guess I would say?
I think so. People sometimes might not even know what help they need. Maybe I'm just not feeling great today, or just the statistics behind things. How many people suffer from a mental health disorder? How many people struggle with depression? What those things can be. We talked a little bit about maternal depression. That's a huge one where I think that could be brushed off to the side as well and just say, oh, I'm just not feeling great. It's just the baby blues. Like, there are many different forms that can take place there. So there's all kinds of different ways. Yeah.
Yeah. Getting that education piece in front of them is a big help then. That makes sense. I worry about this one a lot. Someone wants to share some of their mental health journey. I see there's a line here where some people are either oversharing or some people are undersharing. Do you feel that like having someone like an Ohio Guidestone is a key to that in terms of like the guidance is like what is okay and what isn't okay for them to share?
I think so. I think every person's story is unique.
Sure.
And so if they feel compelled to share their story, share it. Where we need to be careful is that we're doing more good than harm. And I think, in sharing people's own personal stories, they need to consider to be careful of who else is involved in their story as well. So if we're talking with a person and their family history is a huge piece of their story, but it might not be appropriate to share that with everyone else, we have to be creative about how can we get the impact of that, but then not really expose those family members while they're sharing their story too. Sure.
That's a fine line to walk. That requires, I believe we talked about creativity before. So we had Dan Crandall in before. He runs very far. You run kind of far also.
Depends on your perspective.
What is a parallel that you can make between running and marketing?
Oh.
I always like asking some weird question like that.
I think it's the mental headspace. And so I in marketing have to step outside of who I am and what I know. And when I'm running and training for a couple miles.
How many's a couple?
Well, when I was training for 100-mile races, I'd be out there for 30, 35 back-to-back days.
You guys are all crazy.
So, but you do have to step outside of who you are. And so I think those are the two parallels for me, is really stepping outside of yourself and putting on somebody else's hat and thinking about that.
You have to meet people where they are instead of where you are for that. That is always a tough thing. What is a key takeaway that you feel that you've gotten from working at Ohio Guidestone?
I would say our community of employees really is just something special and empowering. We have even people that have struggled with substance use that have become peer recovery supporters that have gone on to get more education that's been provided to them by Ohio Guidestone. And then they're now helping people from, it's full circle. So I think just for us to be able to share those stories too, I have never met anyone that I've worked with that has had anything bad to say or negative to say. And I'll say just from our communications team too, like we all work very well together. We all have different perspectives and backgrounds, and we come together and collaborate. And we love sharing everyone's stories too. So it's really humbling and really just a happy thing to really reflect on and see someone's journey and their path grow to a greater place.
That feels like that's a good way to go home at the end of the day and be like, I did something good today.
Yeah. I mean, we aren't providers, right? So we're not directly impacting someone's life. So to be able to know that, we're loosely connected to that is a really nice feeling.
That's very cool. I really appreciate you coming on today.
Thank you for having me.
This was a good conversation. A lot of really cool things that came out of this. To me, it's funny. There's been themes about educating your clients, getting out in front of people, and then those collaborative things that the last 4 or 5 guests have all said. And to me, it's something that we're definitely going to be working on. You should probably be working on too. Do me a favor, as always, push all the buttons, do all the things, take care of yourself. And if you can, take care of someone else too. I will see you all very soon. Creating engaging content can feel overwhelming, but it doesn't have to be. That's why I'm excited to share our Stomping Podcasting newsletter. You'll get actionable insights and expert tips straight to your inbox. These are to help you maximize your video marketing and podcasting return on investment. Head over to the show notes and click the link to subscribe to our free newsletter. Don't miss out on this opportunity to become a video marketing and podcasting pro.